So you're playing sort of that role of like occupational medicine as well, like almost that WCB side of things of like, okay, how did things go at work? And it's all work related.
That's right, and that's the other part of the job. There is a lot of that occupational medicine, which you kind of there's no formal training. There's like a 90-page document from like 10 years ago that's circulating around that like some new doctor like created, and people have been like adding to it, but it's sort of like informal. And so most of the training happens like on the job, and that's the nice thing about working in this place. That's the other. So you were asking like, what my favorite part of working here, it's the team that I work with. I really enjoy like working in this multidisciplinary team. And like honestly, everyone has an open door policy where, whatever question you have, you go in and you talk about cases a lot, brainstorm. It's we have some formal sort of like rounds, but we also do a lot of like informal, just like talking and about different cases and things. So there's a lot of help, a lot of support to get you through not just the occupational medicine, but also the just medicine in general, which was another thing that I quite liked after graduating from residency. It's like a little bit of extra support.
And so the bases are across all Canada, like they're all over the place. What's the medical team like at these different places? I imagine there's some variance between the two, but are they typically like how many doctors, civilian doctors like yourself, would be practicing on one base, or how many internists or surgeons or other types of colleagues would you be having your daily or weekly rounds and discussion over patient cases
So
with?
it varies quite a bit base to base, and time to time. So I can tell you, like, there's some times when like we've had, I don't know, probably like 10 physicians, and that'd be a mix of like Calian physicians as well as the military physicians, like family docs working at our clinic. And there were times when like we'd have like two or three. We were like a skeleton crew running because everyone got deployed, and so it really varies. But and then we have like physiotherapy, occupational therapy. We have social workers, psychiatrists, and then the specialists. It depends base to base who they have. For example, our base, we don't have any like ortho or um, any other specialists other than psychiatrists. But the nice thing about the military is because they are the patients, they are Blue Cross funded. The specialists tend to give them um, sort of a preferred treatment in terms of like wait time. So they end up being seen a lot quicker than you do in the civilian side. And so, you'll get even imaging and like ortho referrals or any specialty referrals kind of like get seen like probably half as fast.
Very cool. So there's less of that frustration just with the system as most of us out in the community are experiencing. It's just a little bit more well oiled of a machine there.
That's right. Like I never really have to, like working here, I never have to think about, my patient not being able to afford like drugs or physio or something. It's just, they just get, it's never a thought. So it's kind of nice from that sense.
The day to day, like, like when you start your day, walk us through it. How does
Sure.
this
So
actually
so
work?
the days typically start at 7:30 in the morning, and it starts with parade, which is another, it's a fancy way of, I guess, of like a walking clinic. So 7:30 usually to like 9:30 or 10 will be the walking clinic where people from the base, they just kind of come in and report with whatever like acute things they're having, medical issues and concerns. And so the whole team is kind of seeing those people. And when you finish with that, you start having your booked sort of patients, and that goes from around like 9:30 to about 12 o'clock. Then you can go for like your 1 hour lunch break, and after that you see patients again for another 2 hours, and then you get usually like 2 hours of admin time, and that's all. And you get paid hourly, so you don't have to, you don't worry as much about um, you know no shows, and you don't do it, you don't have any overhead, so you're really just like, you're just focusing on patient care and nothing else.
Very cool. That's like one of the biggest gripes people have in the community is just the amount of unpaid admin work and just that huge burden. And so that's sort of
It was one of
no
the
longer a
nicest
problem
things
for you.
of working here, was just that, like, I just do my work, doing, seeing the patients, and that's all I need to care about. And at the end of the day, I just like put in my hours, and it's always the same, but you just keep going through those motions, and that's it.
And did I hear you say you get to sit there for 60 minutes and just enjoy your lunch?
In theory, yes. In practice, no.
Okay, so that's similar then.
So like I end up seeing like patients through like the lunch hours, and there's always someone, and no one's kind of forcing me to do it. It's just, I want to call patients about like results and whatnot. I don't want to like just keep deferring it, because you can't just say like, well, book this person when I'm next available to like review it. But I just end up doing it sort of on the fly, and so it takes up a lot of times my lunch hour. Sometimes I'll see like some patient that came on sick parade, but I'm their regular sort of physician, so I just like slot them in later on or something.
Duty calls, I guess. Okay, so some parallels between being off base and on base still, working over lunchtime sometimes.
But I will tell you, so when you're kind of like, when 4 o'clock comes and you finish, like you're done. There's no more. A lot of times at the beginning when you start, you can't even take like the EMR home, or like, so you just like finish your day, and that's it. There's other doctors that come on call if there's like any kind of like on call work to be done. So you're not working evenings, you're not working weekends. You kind of just do your like 7:30 to 4, and that's it. So that's the other nice part, is that there's you kind of just like, you usually just work whenever you know just during the hours that you're given. I mean, in practice, I've tried it in whatever after hours. That's, I guess, a bad habit from from all the other jobs, but it's nothing close to what it was like working in the other places that I've worked. It's fairly manageable, and actually you can finish everything um, during your allotted hours. And the other nice part is that like the clinic managers are very flexible. So like, if I'm like, sometimes if I'm just like running like behind for a couple of days, and the admin stuff is like building up, I'll ask like, hey, can I have half a day of like admin, and they'll find it and they'll put it in, and so I can catch up.
I'm Dr. Jordan Vollrath, and you've been watching Cherry Live, brought to you by Cherry Health. Please like and subscribe to see more clips like this, or check us out at www.cherry.health, Canada's medical network.